Have you ever stood up and suddenly felt the room spin for a moment? Or perhaps you were walking across the room when you felt lightheaded, as if you might faint if you didn't sit down quickly. Maybe it lasted only a few seconds. Maybe it happened once and then disappeared. Or maybe it has started happening more often. For many people over 60, dizziness becomes an occasional part of life. And when it happens, the first reaction is often confusion. Was it just dehydration? Did I stand up too fast? Is this something serious? In many cases, dizziness is harmless and temporary. It can happen when you are tired, dehydrated, or when your blood pressure changes quickly. But there are times when dizziness is the body's way of warning that something deeper may be happening, especially involving the heart. Your heart plays a central role in keeping your brain supplied with oxygen-rich blood. If that flow of blood changes suddenly, even for a few seconds, the brain may respond with dizziness, lightheadedness, or a feeling that you might faint. This is why dizziness is one of the symptoms cardiologists take very seriously, particularly in adults over the age of 60. Today we're going to talk about dizziness and its connection to heart health. We'll discuss why dizziness happens, how the heart can be involved, the common causes doctors see in older adults, and the warning signs that should never be ignored. Because while dizziness is often harmless, there are situations where it can be an early signal that your heart or circulation needs attention. And understanding those signals can make a very real difference in protecting your health. To understand why dizziness can be related to the heart, we first need to talk about how the brain receives blood. Your brain is one of the most sensitive organs in the body when it comes to oxygen supply. It requires a constant flow of oxygen-rich blood in order to function properly. Your heart is responsible for maintaining that flow. Every heartbeat sends blood through arteries that carry oxygen and nutrients to the brain. When this process works smoothly, your brain receives exactly what it needs to keep you alert, balanced, and focused. But if blood flow to the brain drops suddenly, even for a few seconds, you may feel dizzy or lightheaded. This can happen if blood pressure falls suddenly, if the heart rhythm changes, or if the heart is not pumping efficiently. In most cases, the body corrects the problem quickly. Blood pressure stabilizes circulation, improves, and the dizziness passes. But when these episodes happen repeatedly, they deserve closer attention. One of the most common causes of dizziness after 60 is a sudden drop in blood pressure when standing up. This condition is known as orthostatic hypotension. When you move from sitting or lying down to standing, gravity pulls blood toward the lower part of the body. Normally, the nervous system quickly signals the heart and blood vessels to adjust. The heart may beat slightly faster, and blood vessels tighten to keep blood flowing to the brain. But in some older adults, this adjustment happens more slowly. For a brief moment, the brain receives less blood flow than usual. The result may be dizziness, lightheadedness, or a feeling of unsteadiness. You may notice it when getting out of bed in the morning or standing up after sitting for a long time. Most episodes last only a few seconds, but if they happen frequently, they should be discussed with a doctor. Orthostatic hypotension can be related to dehydration medications, nerve conditions, or problems with blood pressure regulation. And in some cases, it may also be connected to heart health. Another heart-related cause of dizziness involves abnormal heart rhythms, also known as arrhythmias. Your heart normally beats in a steady rhythm that keeps blood moving efficiently. But if the rhythm becomes too fast, too slow, or irregular, circulation to the brain may temporarily decrease. This can lead to dizziness. One example is atrial fibrillation, a common rhythm disorder in older adults. In atrial fibrillation, the heart beats irregularly and sometimes rapidly. When this happens, the heart may not pump blood as effectively as it should. Some people with atrial fibrillation experience palpitations, fatigue, or shortness of breath. Others notice dizziness or lightheadedness. Slow heart rhythms can also cause dizziness. If the heart beats too slowly, it may not pump enough blood to meet the brain's needs. This condition, sometimes called bradycardia, can lead to fatigue, dizziness, or fainting. In certain cases, doctors treat slow heart rhythms with a pacemaker, a device that helps maintain a stable heartbeat. Heart valve problems can also affect blood flow to the brain. Inside the heart are valves that control the direction of blood movement. If a valve becomes narrowed or does not open properly, blood flow from the heart can be reduced. One example is aortic valve stenosis, a condition in which the valve that allows blood to leave the heart becomes narrowed. When this valve becomes severely narrowed, the heart may struggle to deliver enough blood during activity. This can lead to symptoms such as chest discomfort, shortness of breath, and dizziness. In some cases, people with severe valve narrowing experience dizziness or fainting during physical exertion. Because this condition becomes more common with age. Doctors often evaluate dizziness carefully in older adults to rule out valve disease. Heart failure can also contribute to dizziness. When the heart is not pumping efficiently, circulation to the brain may sometimes be reduced. This can lead to fatigue, weakness, and occasional lightheadedness. Heart failure often causes other symptoms as well, including shortness of breath, swelling in the legs or ankles, and reduced exercise tolerance. If dizziness appears together with these symptoms, medical evaluation becomes particularly important. It is important to remember that not all dizziness comes from the heart. In fact, many cases are related to the inner ear. The inner ear contains structures that help control balance. When these structures are disturbed, the brain may receive confusing signals about body position. This can lead to a spinning sensation known as vertigo. Vertigo often feels different from heart-related dizziness. Instead of lightheadedness, people may feel as though the room is moving or spinning around them. Inner ear conditions are a common cause of dizziness in older adults, and many of them are treatable. Other non-heart causes of dizziness include dehydration, low blood sugar, anemia, infections, medications, side effects, and neurological conditions. This is why dizziness should not be diagnosed at home, but certain patterns can help indicate when the heart may be involved. Dizziness that occurs together with palpitations may suggest a heart rhythm problem. Dizziness accompanied by chest pain or shortness of breath should always be taken seriously. If dizziness occurs during physical exertion, especially when walking or climbing stairs, it may indicate that the heart is struggling to supply enough blood. And dizziness that leads to fainting even briefly requires prompt medical evaluation. Fainting, also known as syncope, can sometimes be related to serious heart rhythm problems or circulation issues. When doctors evaluate dizziness, they often begin by asking detailed questions. They may ask when the dizziness occurs. Does it happen when standing up? Does it occur during physical activity? Does it come with palpitations or chest discomfort? They may also review medications, hydration habits, and sleep patterns. A physical examination helps evaluate blood pressure, heart rhythm, and circulation. In many cases, doctors measure blood pressure both while lying down and standing to check for orthostatic hypotension. Additional tests may include an electrocardiogram to check heart rhythm, blood tests to evaluate anemia or electrolyte levels, and imaging studies to assess heart function. If dizziness occurs frequently, a heart monitor may be used to record heart rhythm over several days. These monitors can detect rhythm abnormalities that might not appear during a brief office visit. There are also simple steps that can help reduce dizziness in everyday life. Staying well hydrated is one of the most important. Dehydration can reduce blood volume and contribute to drops in blood pressure. Standing up slowly can also help. Instead of rising quickly from bed or a chair, take a moment to sit upright before standing. This allows your body time to adjust circulation. Regular physical activity improves circulation and helps the body regulate blood pressure more effectively. Balanced nutrition supports stable blood sugar levels, which also influence energy and balance. If medications are contributing to dizziness, your doctor may adjust the dosage or suggest alternatives. Protecting your heart also protects your brain. Managing blood pressure, controlling cholesterol, and maintaining healthy blood sugar levels all help support healthy circulation. Avoiding smoking, maintaining a healthy weight, and staying physically active strengthen the cardiovascular system. These habits cannot eliminate every cause of dizziness, but they significantly reduce the risk of heart-related circulation problems. Perhaps the most important thing is learning to listen to your body. Occasional dizziness can happen to anyone, but repeated episodes, especially when combined with other symptoms, should never be ignored. Your body often sends subtle signals before serious problems develop. Dizziness can be one of those signals. If you notice dizziness becoming more frequent, more intense, or associated with chest discomfort, breathlessness, or fainting, it is time to speak with your doctor. Early evaluation can identify problems while they are still manageable. And in heart health, early attention often leads to the best outcomes. Dizziness may seem like a small symptom, but sometimes small symptoms carry important messages. Your heart works continuously to supply oxygen to your brain and body. When that system changes even slightly, the body often responds with signals like lightheadedness or imbalance. Paying attention to those signals can help protect your health as you age, because sometimes the body whispers long before it shouts, and understanding those whispers can make all the difference.